absolutely cracker of a topic which I think everyone within design wants to know a little bit more. So I'd love to introduce you to Lanre all the way from Canada. Without any further ado, Lanre, I'll leave it to you. Yeah.
Hello, everyone. Um, it's nice to be here, and thank you for inviting me again. Um, yeah, so let's get right into the discussion. Before I start with the talk, I will quickly introduce myself. My name is Lanre Jerry-Ijishakin. I work as a user experience researcher and a customer experience accessibility designer at Macadamia Technology. Macadamia Technology is the design-led engineering arm of IMID, and it's a consulting firm which supports companies in designing and researching, designing, and even developing products, whether service design or digital product design. So, my topic for today, some of us might be a bit familiar with it, but for everyone, I think it's going to benefit us in one way or the other, and there's something we will be able to take out from it. So, I'll be speaking on why inclusive design. Sorry, I think I'm jumping ahead of myself. Yeah, I'll be speaking on designing for inclusiveness in healthcare, and I'll cover four main areas: why inclusive design matters in healthcare, why the business impact for inclusive design, and then looking at the relationship between usability, accessibility, and inclusive design. And lastly, talking about how we can apply shift left principle in product development. So let's dive in. I will start with using three user scenarios to illustrate why it is important to consider inclusive design in healthcare. You will agree with me that considering diversity among users of healthcare products and services, it's very important because we have different needs, and we also humans interact with their environment through different ways. And so our first user here is a non-mouse user. What does that mean? So Liuso, it's someone that works in the healthcare space as a medical assistant. He experienced severe pain on his right hand and wrist. As a result, he prefers to just tap through the keyboard to get his work done rather than using the mouse. And then we have Amira, a Tai-Tai-based user. She was born deaf, and with the help of technology, she's able to do a lot of things independently. She desires a app that can be connected to her phone and help her with her medication reminder. But this app has to be compatible with a smartphone that has haptic functionality. So it gives notification or uses the touch sensory by vibration instead of sound, which most of us are kind of used to alarm as a form of reminder or just display notification. But for someone that is deaf, the preferred means is through touch or signs. And then we have our third user who is a mobile app user. I believe for most of us, we are kind of very familiar with using mobile app on our phones. And you agree with me that with the event of the COVID pandemic, many people have had to access healthcare services through their digital devices, whether phone or laptop. And so Colin has mobility challenges, and his session was moved to an online opportunity for him to be able to attend his cognitive behavior therapy session instead of going in person. And this was a great experience for him because it reduces his necessity of him having to travel to the clinic to see his therapist. But then if the application is not designed in a way that can support good experience using phone, then calling will not have the best experience. So I say this to let us see how we should start thinking beyond designing for usability, but designing for inclusiveness, that we are considering users that are not within the range of what we call typical users or target users. I'd like to share with us data from United States Disability and Health. This was released in 2018. And if you look at this figure, you will quickly notice that people with disability, adults with disabilities, have higher possibility for healthcare needs. It shows that adults with disability, 38.2% have obesity compared to those without disability. So what it implies is that more people with disability are accessing healthcare. And so if our product will be used by more people with disability, can this product meet their needs? Can they interact with this product? Yes, it has been built around being able to probably help them in their weight management, help them to stop smoking, help them with um, medication reminder for those who have diabetics. But then, can they operate these devices or application or access these services even with their different ways of interacting with their environment? And just to say that healthcare product is not just for patients. It's very possible to quickly conclude that, oh, most of the products, yeah, but I'm sure there's some of us here that our products either serve other key users in the healthcare ecosystem. So we have four major players in the healthcare ecosystem. It could be the providers, patients, payers, or policymakers. And if you look at the product that you are either designing or developing, it is most likely to serve at least one of these key players or all of them. So an example is, for a patient, we just discussed about mobile applications that could be used for managing their chronic healthcare needs, or maybe patient portal where people want to check their prescription or check their lab results or things like that. For providers, we are looking at electronic healthcare record system, medical devices, and yeah, policymakers also make use of digital healthcare products. Aside from the fact that they could be patient at one point or the other, but even for their work, they sometimes use dashboard or data management systems. And so, if we look at our product, we will see that in a way, it's likely serving one or two or more or all of these key users in the healthcare ecosystem. And um, I would like to further iterate this point by giving us this data from World Bank, World Health Organization. Um, 15% of the population, global population, lives with disability, and that gives us 1 in 6 of our users live with a form of disability. And so, if you look at it, this implies that part of the users you're designing for could either be living with a disability. So 1 in 6 of your users is likely to be living with a form of disability, whether it's a patient, a provider, a payer, or a policymaker. They will most likely fall within this category. And another point is that healthcare product, because it's an essential need, it means that we might need to look beyond just designing for an average users who might not have challenges with interacting with platforms, that are designed to work in a certain way, right? But when you think about the possibility of people having disability at different stages of their lives. Some people, it might be permanent disability, whereas some people might actually develop disability later in life, which might be as a result of old age. And there are also instances whereby people have, situational disabilities, right, where for some reasons they could not interact with environment or the way they should, because of what they are going through at that particular time. I would like to give an example. So we could have people with mobility disability, hearing disability, vision disability, or speech disability or cognitive disability. I would like to illustrate with someone that is deaf. So for someone with hearing disability, and you have a telehealth service, this person can conveniently benefit from using telehealth service if it is well designed. And what do I mean by this? That is, there's provision for multiple means of communication. The client can decide to use the chat, or there are other options of if someone wants to use phone call, if someone wants to use video call. But for someone that is deaf, the most likely preferred option will be chat and video calls, because some people like to read the lips and also read the text along the side. But the interesting thing is that this might also serve other users. So, for example, a client might not be deaf, a patient might not be deaf, but it might be in a noisy environment when he has to access this service. And because of that condition or that present situation, it might benefit that user to communicate with the provider using chat, right? So accounting for this, when we are designing to provide multiple options of interacting with our platform, actually benefits everyone beyond a particular group of people or target users. Another example is for a second language user, speaking a second language client speaking with a provider. It might be more efficient for this user to type in the chat box if they have difficulties in pronouncing certain words. So these are instances that make us to see that it just goes beyond just designing for someone, considered to be not a typical user, but to see that considering accessibility can actually benefit everyone beyond the just a narrow scope of people who have um, their own way of interacting with platforms. Yeah. So my key takeaway here is that we should look at products that it should be accessible for everyone. And the only way we can achieve that is to go beyond designing for average users. And if we look at accessibility and inclusive design, to see what does that mean for businesses, there's a huge business opportunity when we design for inclusiveness. Paul Smith, the head of digital accessibility at Barclays, said embracing accessibility leads to multiple benefits. One, reduces legal risk. Two, strengthens brand presence, improves customer experience and colleague productivity. And I couldn't agree more. I will use certain statistical data to further buttress this point. In 2021, there was over 4,000 ADA, that's accessibility related lawsuits in the US. And what against companies, and what this means is that companies will have to settle these claims. That's a huge expense. And also, they will still have to fix the product. Otherwise, they will continue to get lawsuits. So at the end of the day, if they invest in accessibility upfront, they're actually saving a lot of money. The second data I would like to share is that there's a huge capital that people with disability have access to. So according to Web Accessibility Initiative, the annual spending power of people with disability is estimated to be $6 trillion globally. $6 trillion. That is huge. And so when we consider healthcare as essential commodity, we will see that designing for people with disabilities, because they will access this commodity, it's very important and should be serious business. It should not be something that is an afterthought, because there's a huge market for our product when we make it inclusive. And also, United Nations reported that companies in the United Kingdom that are listed in the Financial Times Stock Exchange, um, that do not meet the basic accessibility compliance, they lose out in about $147 billion revenue. I believe you agree with me that this is a huge resources or huge revenue loss to this company. So when we look at investment into accessibility, we see that there's also an untapped opportunity that can come back as a return. So it's not just about, oh, investing into accessibility, we're going to delay the product release, it's going to take more time, we're going to need more, specialized people to work on it, and all those things that we might be thinking about, especially product team. And I'm not just saying this to call anybody out, but just to say that yes, it's good to account for risk, threats in product life cycle, but also looking at accessibility as a good investment is something that we should bear in mind, because there's a huge return in investing in accessibility and inclusive design. I'll like to share an example of a product that has given a very good experience and was designed specifically for people with access need. This was the dark mode, which is one of the numerous um, products that has been designed for accessibility. So Apple in 2018 launched the dark mode, and over the years, a lot of people have adopted it. And this product has not only been used by people with disability, but also people without disability, because it benefits all. There was a survey conducted by Email Opus, and I think it was 2019, and it was reported that 95% of the survey respondents said they would prefer to use dark mode. Right. So we see that it was designed to help people who might experience stress by using the bright mode that so much light into the eyes, and realizing that also benefits other people who, just by having access to this product or this functionality, was able to make them easier to view things, especially when they're outside. It gives better color contrast. And so the benefit of building product that is inclusive is not just for a very narrow or small group of people. It's actually for everyone. And I hope I've been able to buttress this point enough. Okay. Okay, so let's look at, when we're talking about usability, accessibility, and inclusive design, what are we saying? What are we referring to here? I'll say that usability is like the starting point. That's like the least we can do. Most of the times we focus on, oh, can users make use of our product effectively? Can they make use of it with ease? Right. And when we look at this and we do our testing, evaluation, and it passed, it's very easy for us to see that as, yeah, we have, minimum viable product. Our product is good to go to the market, right? But that is just the starting point. It's important to go a step further, and that is looking at accessibility. And in this case, we are talking about can this product serve people with disability? Can functional usability of this product by by certain people that interact with a product in a different way outside of how the average users will interact with it. And an example I will share here is someone who uses voice command. Can they successfully book an appointment from their phone using voice command? Or they have to get an assistance of somebody to help them book the appointment? And the bigger umbrella, which is like extending it to a broader spectrum or scope, is when we look at inclusive design. When we are saying that our product is the usability extend beyond the identified users. So we are not just focusing on a narrow scope of people, but we are thinking about if people have to use this under another circumstance, will they still be able to function well? So, for instance, you develop an electronic healthcare record system for providers. This, it can work well, but then this provider, a lab scientist, has to enter lab report without having to use the mouse, and they just want to tap through the keyboard because they have probably one their equipment or something on one of the hands, and they just want to use the second hand to just type in the information or tap through using the keyboard without having to use the mouse. Can they effectively and satisfactorily achieve this goal? So it's not it goes beyond just making the product okay, it's accessible, it passed the web content accessibility guideline for creating accessible product, but is it delightful? Can they use it in a way that makes them feel like yes, they were considered when this product was designed, right? So that looking at inclusive design, to talking about like you are not actually segmenting users, but you are actually looking at everyone and considering the diversity of interaction with the environment and with products. And we can see that there's a relationship between these three concepts. And so it is important to consider the three from the beginning to be more effective in our product design. And so to help us, start thinking about designing for inclusiveness, I would like to talk about principles that guide um, accessible product designs and development, and also how these principles are connected to inclusive design. So accessibility principles, there are five of, there are yeah, rather four of them, and this has to do with perceivable. Can users um, perceive the information and content of your product, of your website, of your application using different sensories, whether through their auditory sensories or through visual or through touch? Can they effectively, can they perceive correctly the information and interface, interact with it using these different sensories? Can they operate your application with their own choice of input? I just spoke about someone choosing to use keyboard. If they want to use mouse, can they use it well? If they want to use keyboard, can they use it well? If they want to use touch, will it provide great experience and they'll be able to achieve their objective? And thirdly, can the information and operation of the user interface be easily understood? So for someone with cognitive disability, can they easily navigate around your application or website and find it easy to get to where they are going or what they want to achieve? And lastly, is the application compatible with different assistive technology? I initially used spoke about a tactile based user who wants to connect a health application to a haptic phone. Is this provision is it made for this kind of user to be able to use your application and use it well? And if you look at inclusive design principles, you will see that there's a connection between these principles and accessibility principles. So when you talk about, placing people at the heart of your design process, it's when you say people, you're talking about everyone. You're not excluding certain people. You're not talking about, oh, just once my product 75%, 80% of my of I do user testing, 8% can use it. Yes, we are good. We have a product that can get to the market, right? But you're talking about people that have different needs, different abilities, different ways of wanting to interact with things, and you are being human in the way you are designing. So you are being empathic about how you consider the need of other people that are not your average users, right? And that led to the second point of diversity and difference, right? So you're not looking at just a narrow way of people interacting with your product, but you're looking at different possibilities that users can explore or complete their tasks, right? I gave an example of telehealth service. Recently, I signed up for speaking with a nurse practitioner, and I remember we had the two options, whether phone call or video call, and we opted, my husband and I opted for video call. And interestingly, during the session, we needed to provide some information like my name and certain information, and it was much easier to just type in this information. So I just imagine, oh, if I had only phone call as a way to access this service, I'm sure I would have been a bit frustrated because my name is quite long. Olanrewaju Jerry-Ijishakin. That's my official name, right? And so calling that out and spelling it one by one to the provider was going to be time consuming compared to just typing it in the chat, and then the provider could just grab that and put it in the form. Right. So, and there were other information that I had to share that was just more convenient just putting that in the chat. So, you know, thinking about that right from the get go of designing our product help us to make product that is more robust, more inclusive, and can accommodate different ways users want to interact with the product. And I just spoke about offering choices, just whether phone call, virtual, um, video chat, video call rather, or chat, right? So offering multiple ways that people can do things because of that, considering diversity. That also has is connected to flexibility. Like you are not just like, okay, for instance, um there are some applications you might have experienced this where you're using it in portrait view, you have perfect experience, but try to change it to landscape, especially on mobile devices, it becomes a very poor experience. And sometimes it might actually be better for you to be viewing in landscape because it gives you a wider viewport, right? But because that's been restricted to just one way of viewpoint, you are just stuck with that choice, right? But when you make the product in a way that users can be flexible with the way they use it, it provide better experience for everyone. And lastly, convenience and enjoyable. And that's very key because a lot of times when we think when companies or um, designers and developers think about accessibility, what they're thinking about is, oh, I just want to meet the WCAG guideline, the Web Content Accessibility Guideline. Once I pass the success criteria, I fulfill the obligation. But thinking beyond compliance, because you can actually check the boxes and the product provide like terrible usability experience for people using assistive technology. They will be able to complete the task, but there'll be so much frustration. But when you're talking about inclusiveness, you're looking at it in a way that, irrespective of the choice of interaction, the user have a delightful experience. And I would like to state a quote by Ava Pila, and she said, "A good product isn't just one that I can use; it's one that anyone can use." I really like this product. And by the way, Ava Pile is the co-founder of Fable. Fable is an accessibility company that supports with engaging people with disability in interacting with product, testing it before it is being released to the market, and also providing capacity building for people who want to learn more about accessibility. And so this is our own, we co-founder, our own experience of being committed to designing inclusive products. That realization that product is not just because I can use it this way, then that is good enough. No, saying that it's good enough when anyone can use it. And so when we start thinking about it that way, it helps us to look beyond our biases and our privileged way of perceiving information or interacting with things and considering other people choices. And to talk about like practical ways of how we can then start implementing um, accessibility and inclusive design in our product development. I'll be introducing us to a concept called shiftless. So shiftless strategy is simply implementing accessibility or whatever change model you want to introduce into your product development life cycle from the early phase. And for digital product development or even service design, we're talking about moving to the first two phases, which is the discovery and design phase. And these are the like interestingly the most critical um, phases of implementing accessibility, and that is, I'm sure that might be surprising to some of us, because for a long time, accessibility has been left to developers, QA, discover, you do your testing, you find accessibility issues, then you send it back to the developers for retros fix and remediation. But the truth is that accessibility is not all about code. In fact, DQ University conducted a research and they reported that 60 to 70% of accessibility issues could actually be fixed from the discovery and design phase. That is huge. So when you look at that, you will see that if we pay attention and move away from waiting till the product has been developed before we start looking at accessibility or considering accessibility, and we shift to the very beginning of product development life cycle, when we are looking at identifying users' need, defining the product requirement and scope, and during this process, we are actually also considering accessibility or including people with disability in this um, requirement gathering process that helps us to build a product that is inclusive. Also, during the design phase, when you are considering your color palette, your font style or size, and the way the information is going to be arranged, when we consider accessibility here, it gives a huge benefit of saving cost and time at the later on after the product has been developed. And so during these two major phases that I just discussed, how do we make sure that we build in accessibility um, into our discovery and research or design phase? First of all, it's important that when we're conducting research, that we include people with disability in our research sample. We all know, or maybe I should just say, as if you're familiar with user experience research, that it gives a lot of benefits when you do that groundwork, that initial discovery phase of understanding the user's need and not just making assumptions, right? Because a lot of the time when you make assumptions, you develop the product, you get to the market, and you get surprises. It doesn't meet the needs of the users, and then you go back and you try to fix them. But when you are looking at what what are the needs of the users, and then based on their needs and their goals, you are developing that product. Are you also including hearing from people with disabilities to be sure that their needs are considered? Um, what does it mean when you are testing your product, when you are conducting assessment or evaluating products? Do you also include usability metrics so that you account for, I mean, accessibility metrics rather, such that you account for usability experience of people with disability. You're doing heuristic evaluation, and you're not just limiting that to usability heuristic, but going for that accessibility heuristic. And this is available online. Just looking at those principles, best practices, and making sure that you look at this product, in a way violate any of these best practices. And going to design, we're talking about your design system is very key. If your design system is faulty, if your design system has accessibility issues, it's a given that the product will most likely have accessibility issues. So, for instance, if you have, you know, color palettes that have like poor combinations, and there will be contrast issues, somebody with low vision will not be able to interact very well with your product. So, yeah, I see this a lot where you have gray, white, gray text on white background, and very tiny font that you're barely seeing what is there. Someone that has low vision, that has has to even magnify the the website or the application before they can see it. Even after magnifying it, it might still be very difficult for them to interact, to consume this information. And this is something I've experienced firsthand. I remember I was doing a usability testing, and I had this provider. She just scrolling. She was supposed to type something to the search box and get an appointment, if I remember correctly, get a user information, I think about allergy or something like around that. And this provider kept scrolling up and down. And when I looked at the video again, I said there's something likely to be wrong with this search bar color contrast. The border was gray, and you know, for me it was, I could see it, but it looked faint. So I just went to prove further with the designer and say, do you mind let us check the color contrast of this search bar? And lo and behold, by the time we checked, it didn't meet the requirement of 4.5, sorry, 3.0 ratio 1. 4.5 ratio 1 is for text, block of text, but for non-text image, we are looking at 3.0 ratio 1. And it was lower than that. And I was like, wow, it is possible that this is why this user could not see this search bar and could not interact with the product. So, when we're testing our prototypes, can we test for people with disability, whether we test directly with them or we use people who are experienced with using assistive technology that can test the product and give feedback in a way that somebody with disability would have given that those feedback. And so I would like to conclude with two key points. The first one is that accessibility is everyone's responsibility. If this is something you are going with today, it is more than enough to start thinking about in your own role. How do you start implementing accessibility? Start considering accessibility in your work. How do you start baking it in? How do you start looking at how can you contribute to making the product you are working on inclusive? This is something that I would like to leave us with, to start thinking about it and to start working towards. We shouldn't leave it to the developers. We shouldn't leave it to the QA team, the quality assurance team. We have a role to play. Everyone in product development or service delivery, we have a role to play. And lastly, I would like to say that accessibility is not a project, it is a process. It's not about, oh, this project I'm working on. Yes, I've considered accessibility and this I'm done. It is a process. It's a journey that we keep on building product that is inclusive for everyone. And the only way we can do this is by continuous learning. We continue to learn what are the requirements, what do I need to do, and also we continue to get feedback from users with disabilities to understand their needs and improve on our product. And also we consider building a system within our organization, within our team, that has an inclusive culture. Because if we don't work on our culture, what it means is that if you leave that role, what happens to developing or designing for inclusiveness? What happens? So, but if you think about it as a process, you start looking at how do you build a culture that everyone and within the team, whether someone coming new to join the team is onboarded to know that as a team, as an organization, we are committed to inclusive design. So thank you for listening. I hope I've been able to leave you one or two points that you can take away to start working towards designing for inclusiveness in your work at designers or product owner or developers. Please let's stay in touch. You can reach out to me on LinkedIn, and also my email is Olanrewaju Jerry-Ijishakin at gmail.com. Thank you for listening. I'll be happy to get to take questions from the audience.
Thank you for that, Larry. That was fantastic. Really appreciate your time and knowledge there. So we really have two questions to conclude. So the first question is, how do we make stakeholders see the benefits after showing potential profits of designing for inclusivity?
Do you mind repeating that question? How do we, is it, do you say maximize the benefit?
Yeah, now how do we, so when speaking to stakeholders, how do we make them see that designing for inclusivity is actually a profit generator rather than a money drainer? So
Oh,
after showing them potential profits, what else is there to do?
okay. Thank you for that question. So I agree with you because stakeholders is about revenue, right? And the evidence is out there. Two things. Number one, it's you know looking at companies that have built products that are innovative around inclusive design and using that as a case study for going a step further in investing in inclusive design and see what happens to companies that are being inclusive in their design. Um, Example, I would say Apple, Microsoft. There are a lot of companies out there that you will see what effort they've put in and how that has make that product to be used by a wider audience. The second thing is to within your role, what can you do? I gave an example of when I was doing usability testing and I identified the issue. And it was not only that I kept providing feedback. And it's not about you like fighting with stakeholders or trying to make it like, oh, you must do this. It's about like being very intentional and being open to letting people to know because most of the time they really don't know. That's why they don't invest in it, right? So when you start investing by contributing knowledge into your work and what do we need to do to fuse color contrast and showing that data. For instance, you tested a product that has poor color contrast with your style guide, with your design system, and you tested a product with a better color contrast, and then you show that 90% or 100% of the users that tested with this find it like the time of completion of the task was faster than those the product with lower color contrast because it wasn't that quickly for people to identify where the button is or what to do. Stakeholders they like data, they like figures. So speaking the language that they understand to say that what happened is that you get more users to use your product. It's likely that you get that initial interest. And another thing is to build on your wins. So after achieving, gradually as you are able to improve, because not just like I said, it's a process, it's not an overnight achievement. You gradually as you begin to improve and begin to show your wins of what you have been able to achieve with the little effort you have made, you will start seeing the willingness of stakeholders to invest in accessibility. And that has been my experience where organizations decide to start thinking of hiring people who are specialized in accessibility to help the team. I hope I answered that question.
Thank you. That's fantastic answer. Actually, just show your stakeholders the data. They like data and figures. You're right. Okay. We have another question here, and The question is going back to the slide on interconnectedness between usability, accessibility, and inclusive design. I'm also always pondering between what's first, usability or accessibility, and why.
Okay. Yeah. So um, usability will usually come first because that is like the baseline. In fact, you can't talk about accessibility without talking about usability. So, um, if a product is not usable, it's not going to be accessible, most likely. If a product is not usable, it is most likely not going to be accessible. That is almost a given. I'm not saying 100%, but I believe that is the way it is, right? So the product has to have certain level of usability, basic like navigation, layout, um, being intuitive. Someone with cognitive issue, if the product is not intuitive to an average user, and someone that has cognitive, or reading disability, is going to like a multiplied frustration for that kind of user. So usability is like baseline, to be honest. And then accessibility goes a bit further because you are now talking about specific need. So someone using screen reader is different from someone consuming information visually. Someone consuming information, I have this slide. You can see the slide. I'm not if I didn't number this slide, most likely, I mean the content on this slide, most likely you might figure that out. Someone using screen reader that is listening to this slide, we have you have to consider the reading order or the focus order if it's a website. So it is not just leaving it to the user to figure out the information on your website to say, okay, I'm going to read from left to right or from top to bottom. But what does that experience look like for somebody using screen reader? Do you factor in how the information will be consumed and how screen reader will communicate that information to the user? Right? So that is why accessibility is another level because you're now considering specific need and other ways of interacting with environment. So I hope that clarifies that um, the two concepts.
Yeah, I hope that question was answered. Thank you so much for that, Lanre. Um, yeah, so that's pretty much it for the day. Um, I'd like to thank all the speakers, our sponsors, which is Many One, Size Group, Balsamic, Haikwan. I'd like to thank everyone and everyone who's taken time out of their day to register. I know it's not always easy to be able to sit through a day of talks, especially when you have work to do. So tomorrow we're pretty much going to do the same format. We're going to kick off at 9 o'clock. It's going to be an absolutely great day. We limited the amount of speakers. And I just wanted to finish on this. One of our speakers unfortunately had to pull out due to the flooding that's happened in Italy. So we'd like to just send our thoughts and prayers to her as well. So other than that, thank you so much. All the topics will be available on a Google Drive. I don't know if Lanre will be able to share hers. We'll make it available for everyone. But we're also going to edit all the videos and then upload it onto our YouTube channel. If you see the chats on the right hand side, you'll be able to see our channel. But once again, thank you so much. Thank you to Lanre for your time and waking up early. I think it's, what is it, 7 o'clock in Canada
Yeah,
now?
so it's 8:40. Yeah, it started 7:50, so it's 8:40 a.m.
Thank you so much. Thank you. Yeah. And to
Thank you.
everybody who's joined from all over the world, well, thank you again. I know we have people from the east to the west of the globe, especially how big our community is, and we're also moving towards Australia next year. So we'll speak to everybody tomorrow morning, 9 a.m. start, which is GMT +2, Berlin time. Thank you. Have a great day, everyone. Bye bye.
Expert of Ghana here. Thank you for joining, and for everyone that joined from Canada. Thank you. Bye.
Bye bye.
Bye.